So if a patient has missing teeth, are they still a candidate for All-on-4?
Not necessarily. We try to save as many natural teeth as we can, but at some point they may get to the point where more teeth are unhealthy than healthy. And so we just go through one tooth at a time and try to diagnose the problem and come up with the prognosis for that individual tooth. But if it turns out they're going to end up losing more than half of their teeth, it's not that much more of a commitment just to take the rest out. Because at that point, you might be able to save those teeth, but not permanently. I mean, you might be able to do expensive work on those teeth. They can keep them for a year or two longer, but then they're going to be right back in my office having those removed anyway. So in many patient situations, it makes more sense just to take them out.
So are there anything that you do that's special that helps to calm the patient or educate the patient in regards to the fact that they're going to lose some teeth or you're going to take some teeth?
I think we downplay the whole experience for patients. We use a little bit of humor and we say, after all, it's just a tooth. We live in an era where we can easily replace that tooth. It's a big deal, but it's not that big a deal in the grander scheme of things. And patients can see that. They have friends and relatives who are struggling with much bigger problems. So to lose a tooth is a big deal. We don't want to minimize that, but it could always be worse. So we just try to put things in perspective and use a little humor to get them through it.
That's a good idea. So if a patient has a lot of dental fears and they really don't want dentures, is the All-on-4 a good option for them?
The All-on-4 is probably the best option for them. And it really depends on their needs and wants. When we're interviewing patients and finding out what we call chief complaint, what their biggest concern is, some patients will say pain, and there might be different options that we can manage painful teeth. Other people may say the current fit of their denture is their biggest concern, so we might go a different path just to help the denture be more stable. But I think the All-on-4 is rapidly becoming maybe not the gold standard, but certainly approaching that level of care for patients who are missing all their teeth.